Good morning, guys, and welcome to today's board meeting. My name's Amshdeep.
Nadia.
Marvin.
Luke.
Jonathan.
Today's board meeting is in regards to Mrs. B, who is under question for her breach of ethics and codes of conduct. Mrs. B participated in many forms of misconduct throughout her journey as a nurse, breaching domains such as practicing legally, practicing safely, effectively and collaboratively, and acting with professional integrity. She used her position of power for unfair advantage and access, as well as discrimination, providing fake certification, self-prescription of medication, and intentionally recording misleading records for culturally diverse individuals, just to name a few, all of which are breaches of conduct. So based on this case, what actions could Mrs. B have taken to demonstrate understanding of how accountability impacts decisions, actions, and behaviours inherent in the role of nursing? We'll start with you, Nadia.
Ms. B should have followed the 7 nursing standards that ensure safe practice. Based on the case, Ms. B mainly breached standard 6, which is provide safe, appropriate, and responsive nursing quality care. Nurses should have respect for everyone, regardless of individuals' race, gender, age, disability, and culture. Ms. B was making untrue, misleading notes that this would significantly impact the patient's treatment. When a patient has been diagnosed falsely and have been given wrong medications, that would affect the patient's health in the long run. If they have an underlying health condition, it could make it worse. Ms. B has breached the Confidentiality and Privacy Act by sharing information to other patients. Confidential information should only be shared amongst health professionals, for example, doctors, specialists, physiotherapists, and allied health staff. There are 7 C's of communication: cautious, clear, correct, complete, concentrate, concise, and consideration. Ms. B should have asked the patient for consent and also asked if they understand the procedure that's being taking place. There are many factors that affect communication. This can include the individual's emotional or mental state, people with non-English speaking background, or someone with a disability. Ms. B should have organized a translator in this case. Marvin?
Another case for Mrs. B's case, where she has acquired a S4 prescribed medication known as Duramind, as for a non-branded name known as Fentamine. Now, this medication is used to reduce the weight in obese or overweight patients, and is also mainly used just to make for people who are looking for a way to lose weight or to supplement their weight loss. Now, in the case of Mrs. B, she's acquired this medication for misuse or for her own personal use as well. Now, Duramind itself, it takes actions to the body where you would not feel the need to eat, as you feel more hungry. Not to feel more hungry, but also to feel full, therefore not eating anything. However, Mrs. B acquired this medication as a form to use the side effects for her own personal benefit. Now, the actions taken for taking the medication was getting a medical practitioner's details to acquire this medication, using prescriptions, even within knowing well that the medical practitioner knew the medication was not given to anyone or any patients that he was looking after. Now, in regards to her behavior, Mrs. B, as a registered nurse, did not have the full qualification, as her qualifications as a registered nurse was falsely written as well as falsely acquired. All of her certification, including her opera certification, was also falsified. Therefore, she would not really have the know-how, let alone the knowledge base of a registered nurse, to be using this medication and know the protocols that are in place for giving this medication. Now, being a prescription medication, without a prescription, it is considered an illicit substance. Acquiring the substance without a prescription is by all means illegal, and it is against the law. in the case of, in regards to the 1985 illicit substances and drug trafficking. Now, for Mrs. B, she acquired it only for her misuse, personal use, whatever it may be. But she used it and got a hold of a medical practitioner's name, in his name, to get this medication for her home. Now, I see that she's acquiring this medication, so then as a registered nurse, she would be able to acquire it if she wasn't having the certificates. However, her certificates are falsified regardless. And that's all that I have.
Thank you for your input, guys. We'll be moving on to the next part. So I just wanted to ask you, Luke and Junkana, what communication strategies do you think reflect respect of a person's dignity, culture, values, beliefs, and rights, which Ms. B could have applied to the incidents that occurred specifically between 2012 and 2013?
Okay, so in the time frame of 2012 to 2013, 4 major problems came to our attention. But before we get into those, I want to express some communication strategies Jen and I would have done that Miss B failed to do so. She could have used an interpreter, translator for effective communication so that the patient could understand and give consent, knowing all the information and also understanding it. Be aware of feedback that indicates the person does or does not understand. She could have developed a trusting relationship by listening, allowing time and giving full attention to her patients. She could have used appropriate active listening techniques, and she could have used appropriate language, avoiding using medical terminology or abbreviations that a person may not understand, to obtain feedback to confirm an understanding, especially from a non-speaking English background. The 4 biggest concerns noticed between 2012 to 2013 by Mrs. B are: 1. Misleading notes and records of 17 patients that from cultural and linguistic diverse backgrounds receiving vaccinations. The Nursing and Midwifery Board Registered Nurse Standards of Practice Standard 6.5 in accordance with relevant nursing and health guidelines, standards, regulations and legislations. Ms. B failed to show cultural awareness and actions appropriate to practice in nursing and has not taken into accountability if their culture can receive vaccinations. 2. Sharing confidential information to other patients. Fails to adhere to the APRA Nursing Midwifery Board Codes of Conduct for Nurses 3.5. A. Respecting confidentiality and privacy of people by seeking informed consent before disclosing information, including formal documenting such consent where possible. Mrs. B misused her workplace and her power position of being a registered nurse and being exposed to patient private and confidential information, and also having access to a practitioner's login notes. What do you think, Jen?
To moreover add to Luke what he has said, the failure to acquire informed consent from patients is also important. Patients have the rights to make their own choices about medication and vaccines they take and receive, providing they have the full opportunity to be informed about what the medication does to them, the risk involved and the benefits for them. Patients have a right to question the nurse regarding professional conduct of nursing practice. According to the healthcare department, failure to consent from the patient could result in legal action against the health practitioner who provided the care, like Ms. B. Moreover, to add on, unclear treatment provided to the patients without explaining procedures and side effects. Registered Nurse Standards for Practice, Standard 2, engages in therapeutic and professional relationship. 2.2 communicates effectively and is respectful of a person's dignity, culture, values, beliefs and rights. The nurse should follow all code of conducts and professional nursing ethics towards patients and have agreed consent provided to the patient so they fully understands what the vaccine is for and the potential risk factors, its signs and the symptoms that may occur, and the nurse is eligible to say for the next vaccination due. Even after care of taking vaccination should be said to the patient A duty of care being a registered nurse is not being fulfilled. Therefore, Ms. B is not fit for her role as a registered nurse.
Thank you all for your input on this case, and through the immeasurable amount of evidence presented, it is indisputable that Mrs. B has breached ethical practice and nursing codes of conduct throughout the entirety of her work, which she will be facing disciplinary actions for. Thank you for your time and the wonderful information that you have provided, and I'll see you guys at the next board meeting.
Thank you.